This alleged fake doctor was caught walking around the
Hello guys, welcome to the channel. Imagine walking into a hospital, trusting the person wearing a white coat, believing that this person has the qualifications to treat you, only to later discover that something may not be what it seems. That is the disturbing question now surrounding allegations of fraudulent medical credentials involving Nigerian medical graduates, Canada, and South Africa. According to that report, the investigation examined suspected fraud and misrepresentation involving Nigerian medical graduates and alleged links through South Africa to parts of Canada, particularly Alberta and Saskatchewan. The report says investigators conducted inquiries in South Africa, including in Cape Town, Johannesburg, and Pretoria. But viewers, this is where we have to be extremely careful. The claims come from reporting about an investigation. That does not mean every Nigerian doctor is fake. And it certainly does not mean Nigerian medical professionals, as a group, are involved in wrongdoing. The report itself describes the individuals as suspected of fraud and says further findings were expected to be published. So what exactly has been reported? Why is South Africa being mentioned? And what does Canada have to do with this story? This brings us to one of the biggest questions in this entire story. How do you know that somebody calling themselves a doctor is actually licensed to practice medicine? A white coat is not proof. A stethoscope is not proof. A social media profile is not proof. And even a medical certificate or photograph of a certificate should not automatically be treated as proof. Medical professionals are supposed to be registered with the appropriate regulatory authority in the country where they practice. In South Africa, that means checking the relevant registration information with the Health Professions Council of South Africa. Dear South Africa people, please, you have to be careful with fake healthcare providers who claim to be professional.
If I told you there was fake doctors from Nigeria operating in the Canadian healthcare system, would you believe me? A report from independent journalist Mocha Bezergan came out the other day. He actually flew all the way to South Africa to check his receipts and do the investigation. And yeah, it's not just talking about how I think our system is being exploited or I think there might be some loopholes. He shows the loopholes. He shows exactly how this is happening in the Canadian healthcare system. He tries to confront one of these fake Nigerian doctors, and this is how it goes.
It was Dr. Ogochakwu himself. I finally had the chance to ask Dr. Ogochakwu why he is listed as suspended in South Africa.
I don't know who is telling you that I was suspended in South Africa. I was never suspended. I don't know where you're getting that information from.
From the South African Medical Board.
I am not suspended. I suspended my license because I left South Africa, not working there.
Dr. Ogochakwu went from
I was never suspended. I have my full license in South Africa.
To
I suspended my license because I left South Africa.
At that moment, I felt like Dr. Ogochakwu was lying to me.
This guy is practicing as a medical professional in Canada, and he's lying. A doctor is supposed to be one of the most trusted professions. It's a long report, but people need to know the state of the Canadian healthcare system. It's called Sent Home to Die, because the beginning of the story follows this young girl who was sent home to die by one of these fake Nigerian doctors who clearly didn't know what they were doing. You know, I would like to think that this gets picked up by the mainstream news or that some conservative party influencers or Pierre Poilievre talks about this, but this is one of those stories where you can't really just get mad at the liberals. This is a damning indictment of one of our major institutions being healthcare. And if you watch the full documentary report, it shows that even South Africa cracks down on fake doctors more than Canada does. Because in South Africa, they are very cynical and they're aware that they're in a low trust environment and that there's scammers and liars who will take advantage of naive people. Canada needs to realize that this is happening at an institutional level with doctors, some of our highest, most esteemed professionals. So share this report, and if you're in northern Alberta, look out, because apparently this problem is very popular of fake Nigerian doctors in northern Alberta.
A Nigerian was allegedly suspended in South Africa as a medical doctor. He came to Canada and he was caught for fraudulently practicing as a doctor with a fake qualification. I'm a bit confused why some of you are busy tagging me on this video and sending it to me. Did Nigeria appoint this man as an ambassador of the Nigerian character? When South Africans are committing fraud outside of South Africa in other countries, or they are overstaying their visas, or they are found to be illegal immigrants and deported, I don't see Nigerians or myself waking up and saying South Africans are scammers. South Africans are undocumented immigrants. Here's the thing, a criminal is a criminal. It doesn't matter where they come from. Their nationality means nothing. They are just a criminal. So if you need one Nigerian criminal to explain millions of Nigerians, you are not exposing Nigeria. You are just exposing the size of your own thinking. You have no capacity to think beyond a person. It just shows that you have a chicken brain. Sometimes think critically. Think. Anyway, that is part of the long view, and this is pure, the gift that keeps giving.
Hi everyone, this video is about the recruitment of alleged fake Nigerian doctors from South Africa. There is a report from Media Bezegan. It's a 1 hour 45 minute video. I've taken my time to watch that video.
What you're about to see is an investigation into how a physician suspended in South Africa, allegedly for fraud, misrepresentation, and illegal practice, was able to obtain a license and practice medicine in Alberta. In December 2024, a toddler named Alida died hours after being examined and sent home by that physician at an Alberta Health Services hospital. The family has spent the past year seeking answers. This investigation traces the doctor's path from Nigeria through South Africa and into rural Alberta. It examines conflicting records and the conflicting statements of the officials responsible for hiring and supervising him. After completing their investigation, Simply Solitude assessed Dr. Anizoba's overall risk level as extreme. His pattern of practicing without lawful qualification, relying on falsified or misleading documentation, continuing to work after license withdrawal, and misrepresenting himself to patients, institutions, and employers makes him a severe risk to public safety. The report warns that any ongoing association with Dr. Anizoba presents substantial institutional and legal risk, criminal, civil, and regulatory. I traveled to Edson, Alberta to question Dr. Tochakwe Anizoba and give him a fair opportunity to respond. The front desk said he was very busy. I left my contact information, but he never got back to me. Once I saw who holds authority over physician recruitment and placement in Northern Alberta, the pattern began to make sense. Meet Dr. Jane Ojedekun, the Nigerian official responsible for recruiting and placing doctors in Northern Alberta. Dr. Ojedekun regularly welcomes new hires to Northern Alberta. We examined every public welcoming statement released by Alberta Health Services for new physicians in the North Zone. Under Dr. Jane Ojedekun's leadership, the pattern is clear. Of the 18 doctors she publicly welcomed, 67% received their medical training in Nigeria. That is a higher concentration of Nigerian-trained physicians than all of her predecessors combined since 2015. She does not only recruit for AHS, she also recruits for the private clinic she runs with her husband, Joseph Ojedekun, Life Medical Clinic in Whitecourt, Alberta. Nearly every physician she has brought into that clinic is a Nigerian foreign medical graduate.
And I'm not going to come here to start debunking without any reason, but what I'm calling for is for the Nigerian community of doctors, Nigerian community of professionals to gather together and look into this issue. I'm not going to be just striking this issue out or calling it fake because there's a lot of evidence. A lot of effort has gone into that research. But as a community, if we do not stand up to say, yes, we want to be part of that research, yes, we want to be part of that investigation, that anybody who comes to Canada as a Nigerian with fake certificates should be put out of their industry, it definitely rubs on us. In the comment section of that video, I see a lot of people saying, I avoid black doctors, I avoid Nigerian professionals. We have to speak up. To everyone with a platform in Canada, this is not the time to be quiet. And this is not the time to support your own without evidence. This is a time to publicly criticize what is bad among us. I'm calling on everybody who has a platform. Do not be quiet on this issue. Because before you know it, Nigerians will start getting blacklisted in every walks of life. Doctors, lawyers, IT professionals, nurses, care assistants. We need to stand up to this, not to argue against the investigation, but to make sure that we do our own investigation and call out our own that is found wanting. Share this video with everyone that you know that lives in Canada and is a Nigerian. Have a wonderful day and definitely stay safe.
According to the report behind this story, investigators traveled to South Africa and examined information in several cities. The report says the investigation involved background checks, interviews, and undercover work. But at this point, viewers should separate what is being alleged from what has been independently established. That is especially important when real people, professional reputations, and patient safety are involved. Until competent authorities or independently verified evidence establish wrongdoing, we should describe these individuals as alleged or suspected, not convicted criminals. And perhaps the biggest lesson from this entire controversy is this: verify before you trust. If you are visiting a doctor, clinic, or medical center, don't be afraid to ask for professional registration information. If something doesn't look right, verify it with the appropriate medical regulatory authority. And if someone claims they can provide a medical qualification, license, or immigration opportunity through unofficial channels, be extremely careful. Fake doctors are a genuine concern in South Africa, with medical authorities warning that fraudulent practitioners can use sophisticated methods to appear legitimate. So, is the headline "Canada exposes fake Nigerian doctors in South Africa" completely proven? Not based on the evidence I could independently verify. What we can say is that there are serious allegations surrounding a reported investigation involving suspected fraudulent medical credentials, with South Africa identified as part of the alleged pathway. At the same time, South African medical authorities have separately raised concerns about bogus practitioners. The story is developing, and the most important thing now is evidence. Now I want to hear from you. Do you think countries should introduce stricter international verification of medical qualifications? And have you ever checked the registration of a doctor before receiving treatment? Tell me what you think in the comments. If you enjoyed this breakdown, subscribe to the channel because we bring you the latest African news, international developments, and trending stories.